I'd like to bring in a physician at Stanford Children's Health, Dr. Alok Patel. Dr. Patel, thanks for being here. Good to see you again.
Good morning, Terry. Good to be here.
So we just heard Maggie talk about that first Omicron case in Beijing. There's been so much work by the Chinese government, by the athletes, of course, to make these games possible. Do you think they can be carried off safely?
You know, Terry, I think one of the most reassuring things is I did read a statement by the International Olympic Committee, and they were saying that they expect the overwhelming majority of people visiting Beijing for the Olympics to be vaccinated, which is a good sign. I think it's unrealistic to think that athletes can go to Beijing and or return home and have there be no cases of Omicron at all. So with these very strict measures, yeah, it's entirely possible it can be safe. But the thing that concerns me is that China itself has a zero tolerance COVID policy. We just heard about the lengths that they go to isolate and trace one case. You now have thousands of people traveling from really hard hit countries there. So the precautions are going to have to be stepped up. And I hope that every athlete, journalist, members of the team are taking this very seriously, and they're expecting to run into Omicron when they go.
Because the government takes it so seriously. And we just know that Maggie just said something I wanted to ask you about. Health authorities in China say they believe that this one case, the Omicron variant, came from a package sent from Canada. Now, I didn't think that coronavirus was transmitted that much across surfaces, and we know, China hasn't really come clean on a lot of things in this pandemic. Does that make sense to you?
You know, Terry, we never say never in science, but this one feels a little far-fetched. According to all the data we have and according to the CDC, coronavirus can survive on surfaces, but not really for very long. And when we're talking about a porous surface, so something like cardboard, it's only going to be able to survive for a few hours, maybe. You're traveling across internationally, and detecting some virus genetic material on a package doesn't necessarily mean that's enough to actually go and infect you. We know it travels through the air in those droplets. And now Chinese state media released travel history from this individual over the weekend. This individual went to a cinema, restaurants, a hair salon, even a comedy show, and contact tracing involved 13 to 15,000 people. So I feel like it's more likely this is a case of community transmission and not from the mail. And I hope this doesn't spark people to go and start overly disinfecting everything in their lives and to go back to how we were in the beginning of 2020, because you're still more likely to catch it from the air.
That is the bottom line there. Well, let's talk about the United States. There are hopeful signs here. It looks like that Omicron may have peaked up here in the Northeast. We could be rounding the corner on this variant. What does that mean for the rest of the country, do you think?
Well, one of the big reality check here is that the country's not exactly moving at the same rate when it comes to these cases. So we're taking this news from Boston, from California, from Florida, from New York with a little bit of optimism. I mean, a lot of this is based on either case rates we're identifying or some of that wastewater surveillance showing that, hey, we may have passed the real peak of Omicron. But Terry, reality is that we had over 800,000 positive tests a day, 150,000 hospitalized people, and data from HHS shows that almost half the country is facing this huge capacity issue with ICUs. And we know that the hospitalization and death data is going to lag the case data by 3 to 4 weeks. So we should all be prepared that even with this sign that cases may be declining, we've got a tough month ahead of us. So people out there need to take this seriously, because that means more canceled elective surgeries, difficulty to get an appointment, long ER wait times, and you could have trouble finding a hospital bed for whatever reason, whether it's a car accident, trauma, or something. So this is tough, and it's going to move around the country at a different rate, which is what we have to expect.
Still a very serious situation in so many parts of the country. And, Doctor, I wanted to ask you about the Biden administration's rollout, beginning Wednesday now, of free at-home tests. Seems like just yesterday, White House Press Secretary Jen Psaki was mocking the idea that the government would send people tests. Now it's the policy of the White House, but be that as it may, some states, as we were just reporting, have reached their peak. Do you think this plan is too little, too late, or can it really help us get out of this?
Well, I mean, by the numbers alone, it is too late in terms of the Omicron surge that we've seen. This needed to be done last year, as many public health officials were talking about. But if we're going to be optimistic, at least we have a plan in place for a potential next surge, which I'm hoping we don't get to. Because even if we look at the website, which launches on Wednesday, people go in there and they click immediately on that first day. Every single person clicks, and there's no delay magically at all in postal shipping. You still have 7 to 12 days for people to get those tests. And we just talked about what this next month could really look like. So that alone is a little concerning to me. But again, I will stand on the side that says at least something is happening. I hope those free sites, I've heard that 20,000 sites local community sites, federal clinics, rural clinics are going to be offering free tests. We need people to use those as well. And I hope that the insurance process is not too cumbersome for people in terms of submitting that paperwork. So all this needs to happen at the same time. It should have happened 6 months ago, but hey, at this point, we'll take it.
That's a great point. Look, on the bright side, we do have a system now in place for the first time across 2 administrations that failed to do this for what may come in the future with this coronavirus. Dr. Alok Patel, thanks very much for that.
Thank you, Terry.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.